State of Hawaii is facing a $75 million budget shortfall. That has Hawaii's community health centers bracing for cuts to state contracts. But at the same time, the economic downturn means an influx of uninsured patients. HPR's Ben Markus reports on how the state's 4 largest community health centers plan to weather the storm.
A group of construction workers are hard at work building a new dental center for the Waimanalo Comprehensive Health Center. Executive Director May Akamine parceled together funding for the project from donations, the federal government, and the state. She says it took several years for Governor Linda Lingle to finally release the state funds.
But, I was very confident she was going to release it because it meets 2 of her 5-point economic stimulus plan. And that includes building and infrastructure for more jobs. And the second point was to maximize federal funding.
Akamine says they're still $100,000 short of the $500,000 needed to build the center, but she's confident they can raise the difference in time. Money's become a real concern for Waimanalo and other community health centers in the islands. Akamine says the state's informed them of $200,000 in cuts for uninsured patients this year. So she got the staff together and asked for ideas. They decided to register those uninsured patients with the state's low-income Quest health plan.
Many of them do not want to apply for Quest because they feel like they should not depend on the government for any kind of subsidy.
The Waikiki Health Center is following a similar plan. Executive Director Sheila Beckham says the health center staff includes more than just doctors and nurses.
We also have what we call eligibility workers that come in and get people that have no insurance when they come here, try to get them onto insurance, and so again, so that they will have services covered and that we will be able to get our visits paid for.
She adds that they just recently experienced a $50,000 cut from the state. Despite that, the health center's adding doctors.
Additional physicians bring in additional dollars. There's no question about that.
Robert Gentry is a board member and chair of the Waikiki Health Center's Development Committee. Waikiki hopes to rely less on grants and foundations, which fluctuate with the overall economy.
We are starting a fundraising program for major dollars, and it's going to reap wonderful benefits because the folks on Oahu know what kind of service there is here and how good it is.
While Waikiki is expanding, other community health center workers are worried about their jobs. Rich Bettini is CEO of the Waianae Comprehensive Health Center, the state's largest nonprofit.
I had a meeting yesterday with my employees that are scared. They want to know if they're going to have a job.
Bettini says state cuts haven't threatened any jobs yet, but to prepare for the possibility, they've focused on making the existing staff more efficient.
So any employee can go to a very simplified website. They can look at the metrics and they can say, gee, I think my department's okay, and I can relax a little bit. And I think most of the departments have actually increased their productivity. And this has been an incentive. There's a correlation between being productive and keeping your job.
Bettini says donor giving has remained steady, but he expects another round of state cuts. Emmanuel Kintu is also bracing for state cuts. The executive director of the Kalihi Palama Health Center says he's not sure how much will be slashed, but he is pleased the state continues to embrace preventative care.
The challenge is, well, if we have $1, how do we slice it? And we are working together to say, well, in this case, it is important to protect the preventative care dollars, even though the outcomes are not seen until sometimes even years down the road.
Kintu agrees staff efficiency is important to weathering the state's budget woes and the sluggish economy.
So we see the dark cloud coming. We're trying to prepare the best way we can. We know that it hasn't really hit yet.
Ben Markus, HPR News.